Dr. Monica Haar is a physical therapist with Avera who helps patients with their pelvic floor.
And those muscles are found in all of us, male and female alike, and they help control like our bowel and our bladder function, and they also help with sexual function. And if they have a problem, you might develop some pain.
Dr. Haar sees patients that have troubles with urinary incontinence, bladder problems, bowel movement troubles, and just pain in their pelvic floor.
So they will have pain in their pelvic floor, muscle spasming. This pain could include directly in the pelvic floor and might affect sexual function, but it also could include hip pain and back pain because where these muscles are located are connected to everything else in that area.
She says the most important function of the pelvic floor muscles is the ability to relax.
Often this is forgotten when we're talking about pelvic floor muscles, but when you sit down to go to the bathroom, you need your pelvic floor muscles to be able to relax in order to eliminate urine and to eliminate bowel movements. So often that is something that we would be working on with exercises.
The first thing Dr. Hart teaches patients is breathing exercises.
Breathing in causes your pelvic floor to relax or drop down, just like if you were on a trampoline and it went downward. And then breathing out, doing an active Kegel as you breathe out, or contraction, and lifting up is like that trampoline jumping up in the air, and your pelvic floor has to do both.
After breathing, strengthening exercises like Kegels occur. Eventually, after patients do better with the exercises, Dr. Haar adds in complex movements to test the patients.
Can you sit in a chair, do a pelvic floor contraction or Kegel, hold that squeeze while you're also exhaling your breath, and stand up? This is going to give your body the most support that it needs to do functional activities.
Dr. Haar says pelvic floor physical therapy isn't complete without retraining the muscles to work properly, and says if the two aren't working together, it's a failure.
And what about when I go to the bathroom and I have urgency or frequency? How might I use my pelvic floor to help control those urges so that I can recreate or reestablish new, better habits so that my bowel and bladder function isn't running my life anymore, and instead I'm able to do what I want to do, and bowel and bladder function just is kind of a thing that happens without me thinking about it.